Wonderful. Well, thank you so much for having us. My name is Jeremy Wortzel. I'm a second-year psychiatry resident at Brigham and Women's. You'll shortly meet my colleague, Dr. James McKowen, a child psychologist and assistant professor at MGH. We are so thrilled today to present our scoping review on pediatric climate distress after a weekend of hearing all of the ways that climate change can impact our health and the healthcare system. I think it's altogether fitting and appropriate that we end part of this weekend thinking about this important topic. I want to shout out the incredible team of medical students, PhD students, psychiatrists, and psychologists from 7 unique institutions around the world who've made this effort possible. They're pictured here on the screen, but they did incredible work and have a real passion for this topic. Before we delve into the scoping review, I just want to step back for a moment and kind of provide some context of how climate can impact how we think, feel, and behave. And I tend to think about this in several buckets: the direct effects, the indirect effects, and the psychological implications. We see several associations, how increased heat and temperature can exacerbate mental illness, specifically increased rates of suicide and violent crime, as well as manic episodes and PTSD admissions. We also see that there can be baseline thermo dysregulation in patients that suffer from psychiatric disorders, specifically those that have that suffer from bipolar and schizophrenia. Notably, a mechanism that has been observed is sweating, and due to this, we've seen an observation of increased morbidity and mortality during these high heat times, such as heat waves. There's an iatrogenic component as well. The medications that are prescribed for mental illness, including anticholinergics, antipsychotics, and antidepressants, can also alter temperature regulation. There are many indirect effects that have been touched upon in many of these presentations today. A few of them include atmospheric pollutants that can be neurotoxic and have been shown to be associated with neurodevelopmental and neurodegenerative disorders. With changing atmosphere comes changing crop micronutrients, and decrease in these specific micronutrients have been associated with neurodevelopmental and affective disorders. And as our infectious disease colleagues and others have commented on, there is an increased spread of infectious disease and vector-borne illness with these increasing temperatures, many of which, or several of which, can have neuropsychiatric sequelae, which changes how we approach mental illness and our diagnostic approach. And then there are also the psychological impacts. We think about these acute climate traumas of extreme weather events that can lead to increased rates of PTSD and domestic violence. We also see increased chronic climate traumas, annual weather or annual flooding, annual forest fires that can lead to population displacement and civil unrest. And we see these larger existential questions that has been known as climate distress, this anticipatory anxiety, this questioning of what our future means. And luckily in this field, we see a number of literature reviews and individuals researching many of these topics, which actually made it the exciting effort to try and find an area where we could provide new understanding. And so we decided to focus at this intersection of how climate distress impacts the pediatric population. And we chose to look at this through a clinical lens, specifically what this problem looks like. How is pediatric climate distress defined? Who is affected? Who is being studied? And what are those worries? How does this climate distress manifest in this population? We also thought about it from an assessment and diagnostic perspective. Are there any validated measures of pediatric climate distress? And of course, from a therapeutic lens, what treatments have been developed or are currently being developed to address these issues? We'll walk through each of these questions throughout the course of this presentation, but I'll just touch on my methodology, as I know we've all used similar approaches. This is our search strategy, certainly a busy diagram, so I'll just walk through it block by block. We worked with the Harvard librarians to develop our search strategy, developing terms for climate change, mental health, and pediatrics. We drew from 7 different databases and ultimately got around 2,000 or just under 2,000 citations. This then went through a screening process where we screened the titles and abstracts, the full texts, using covidence. This allowed us to do a 2-person blinded screening process. And we specifically excluded articles that focused on physical rather than the mental health outcomes. We excluded articles that had patient population older than 18 years old, although some articles did include both children and adults, and if there was specific mention of children, it was included. As mentioned before, we decided to exclude papers that focused specifically on climate-specific disasters or specific weather-related events, as there are many scoping reviews and many literature reviews on these topics already. And if you search contents on Katrina or on Sandy, those can be entire scoping reviews unto themselves. We also set some other limitations. We excluded papers published before the year 2000 that were not published in English and not peer-reviewed. This ultimately resulted in 80 articles that included original research, pertinent literature reviews, and gray literature. Of note, the gray literature went through a separate screening process. And while all of these will be incorporated into our scoping review, this presentation will just focus on the 38 original pieces of research that were screened. So what did we find? Well, there were a couple of trends that we saw when looking at these 38 articles. The first is that there was an age predominance, that most of these articles, 80% or so, focused on children between the ages of 11 and 18. Only 20% included children under the age of 11. Most of these articles actually had a relatively small cohort, most of which under 200 individuals, with the mean actually just being about 23 cohort. There were 5 outliers, however, as you can see, that had more than 2,000 individuals as part of their cohorts. And finally, the nature of these studies was also interesting. Just about 64% of them used qualitative measures of either survey or case survey or interviews for their methodology. As has been mentioned throughout these presentations today, it's very important to understand where these articles are being conducted. And as you can see here from our literature review, most of these are from the global north, many from the United States and Canada, several from Australia, but an inherent lack of studies from the global south and from developing countries, which is certainly a limitation, both in the nature of how we screen for only English-speaking papers, but also for the nature of inequity within research publication. So now let's return to our themes, and we'll start with the problem. When thinking first about what climate distress is, we search these papers to try and understand and create a unified definition. I think it's important just to note on terminology. Climate distress, climate anxiety, eco-anxiety are all used kind of interchangeably. And one thing that came up time and time again is how climate distress better characterizes the vast array of emotions that people have towards this topic. It's not all anxiety, it's depression, it's stress. And so that's why we chose to use climate distress in our presentation. Of note, the DSM, which is the Psychological Diagnostic Manual, currently does not have a definition of climate distress or climate anxiety or eco-anxiety yet in this version. There were, however, several definitions that kept popping up. The American Psychiatric Association has a 2017 definition that defines this climate distress as a chronic fear of environmental doom. Caroline Hickman, in her 2020 article, who is a leader in this field, I think importantly notes that this climate distress is not a mental disorder, but rather an emotionally healthy response to this unfortunate future. And so drawing these various definitions, our current working definition based on this literature review is that climate distress is a reasonable reaction to awareness of the climate crisis and worries about the current state of the future of our planet. So what were the worries? Of the 20 articles that specifically focused and asked their participants on how they felt about climate change, 100% of them reported negative emotions. And these fell in several categories, including those that felt like they had a loss of agency, that they had a negative impact to their day-to-day life, that they had a negative concept of what their future looked like. And if they were aware of climate change, that this awareness showed a negative future. This is how these articles kind of, over the 20 papers, what that representation looked like in that breakdown. But I want to draw your attention to this bar here. Just about half of these articles also mentioned that there were a lot of positive emotions, that individuals who participated in sustainable activities or in activism still maintained hope for the future and had an optimistic outlook on what the future looked like, which I think speaks to the resilience in children and as an interesting take-home message for all of us. I'm now going to pass it over to my colleague, Dr. McKowen.
All right, thanks, Jeremy. So I'm going to talk about the assessment. So broadly thinking about how was this construct assessed? Make sure I go the right way. Nope, let's go this way. Okay, so there's sort of formal versus informal assessments that were used. There was really only two validated scales to assess anxiety. So you've got the Hug scale, which I think Judy Wu talked about yesterday in her presentation, and Susan Clayton's scale assessing climate anxiety specifically. Nothing really on depression related or nostalgia related emotions. And so many of the studies were asking more informal questions about climate distress, sort of qualitative in nature. As you can see, the majority of the studies were using a qualitative approach to address this issue. But broadly, the qualitative questions that were generated in these studies did cover some of the kind of buckets that some of these anxiety scales do address, sort of like cognitive emotional impairment from distress, functional impairment, is it impacting your day-to-day, their experience of a climate event, and then behavioral engagement in sort of change or activism. So therapeutics is a bucket where we were thinking about, so what were some of the programs, interventions, what are some of the themes here around supporting youth? Generally, they fell into kind of three buckets. 18 papers really looked at some kind of program/intervention, and the buckets really fell on sort of education, nature, and activism. And then within those three buckets, there was a mix of emotion-focused work, so coping strategies, resilience building, a lot of themes around group-based care for youth, which fits developmentally speaking, but also in the way we were talking about community and finding meaning with others. And then a lot of great programs involving youth as the sort of leaders of the program or the intervention, sort of co-creation, which I think is particularly important when we think about helping people with control and thinking about how they can support themselves. So education being in school settings or boys and girls clubs, so a lot of curriculums around climate issues, as well as a lot of storytelling involved in the education piece, sharing your climate story, sharing your climate resiliency, nature-based interventions, so planting trees, cleaning up your community was shown to be useful in helping kids feel less anxious and more supported. And then activism is the big piece. You know, we had to speak yesterday talking about our own activist story, but a lot of youth engaged in activism. There's a tendency to push kids to activism as a real solution. And I think there's some risk there of burnout for young people, or if we don't really address the anxiety or the grief that they experience underneath that, I think we can, it can be challenging for their mental health. So conclusions and gaps that we came to. So thinking about the problem first, so some conclusions we can draw from how the problem is defined is that the majority of youth sadly do report experiencing climate distress, but hope is there. So future direction we thought about was we certainly need more generalizability from the global south. We know that psychiatric illness is defined differently culturally. There's different manifestations of mental health with different countries and cultures. So are we talking about the same thing? Is an experience in Bangladesh the same as it is in the United States? We certainly need studies in younger children. So the latency age and younger, how do they experience distress? How does it manifest for them? We can't really ask a 4-year-old to complete a scale, but maybe we can try and understand how they might be experiencing distress. So from the assessment section, really just a lot of variation in how it's assessed. Not many studies really using sort of qualitative measures or really validated measures. There's pros and cons to that, of course. So I think our future direction there would be really trying to develop youth-specific scales. The Huggs and the Clayton scale are not specifically in youth. They really develop for adults, and which is often true in child. We sort of put adult stuff onto kids and assume it's sort of the same manifestation. But I think there could be different questions you would ask kids to better assess what mental health issues they're experiencing. So for therapeutics, again, it depends on how we think about the problem, right? So if it's sort of not really a pathology or a mental health issue, we wouldn't develop a clinical intervention, but we certainly would want some evidence-based strategies to build resilience, build stress and coping strategies, some good literature on the development of meaning-focused coping, transformational resilience, in young people. So not just pushing them into, as problem solving as a solution to an issue, really trying to have them build community together, thinking about how to move beyond these issues in a sort of meaning-focused way. And then also some really good work on it involving Indigenous communities. There's some studies looking at Inuit children and how they've been working together to try and understand the crisis as well as feel a little bit better. But there's a lot to do in that space. So future directions, we're thinking of some increased evidence-based approaches, really resiliency building. We sort of put the task of resilience onto youth, really, because that's all they have to do. We're forcing them to build resilience with this issue that they have nothing, they didn't contribute to and they didn't cause. So it's kind of sad on some level, but it's important that we do support them in building resilience. And then I think one of the goals that we have is really to use a workable clinical tool for clinicians, because many clinicians aren't really sure what to do, where to go from here, how to talk about it. In the breakout room yesterday, we talked a lot about how to talk about climate stress with young people or adults even. So we're thinking of using this scoping review to hopefully develop some resources for clinicians. And that's our review. So thank you, everybody.